Today I am doing my presentation on Dauphin County Drug and Alcohol Services. For this presentation, I interviewed Kristen Varner, who is the director of Dauphin County Drug and Alcohol Services. So the mission statement for this organization is to serve those affected with substance abuse problems by providing high-quality prevention, intervention, and treatment services in Dauphin County. Their vision is to provide accessible and comprehensible care for both adolescents and adults that need treatment and/or intervention services. Their fundamental goals are for the community to have a greater understanding of the health risks related to the use of alcohol, tobacco, and other drugs, for the community to understand the benefits and expected outcomes of drug and alcohol service delivery. Services will be evidence-based and innovative, which will lead to more diverse treatment options reaching diverse populations. The service will assist clients in maintaining self-sufficient lives, and the services will be evaluated. Priority populations are pregnant women, injection drug users, women with children, overdose survivors, and veterans. The services that are provided are treatment services, intervention, prevention, and support services. So support services empower people through education on addiction, improve public understanding of addiction and recovery, eliminating stigma and discrimination faced by those with substance use disorders. Intervention services serve the purpose of identifying an individual abusing alcohol or drugs and to support his or her entry into treatment. Intervention services also provide individuals with the needed resources. Prevention. The prevention program activities are provided in various settings to targeted populations affected by risk factors associated with substance abuse. A list of prevention providers are listed on the Dauphin County Drug and Alcohol Services website. So one of the programs that I saw on their website that I thought was interesting is the Student Assistance Program. The purpose of the program is to be a resource for parents, school staff, and other people who care when students are showing signs of problems that may affect their success in school. Free training forms are offered to the public for those interested in receiving treatment and prevention-related training. Some warning signs for individuals to be aware of for students is withdrawing from family and friends, changing friends and no longer hanging out with their old friends, talking about suicide, acting aggressively, lying, a sudden drop in grades, and use of alcohol or drugs. The website also has information regarding gambling addiction, which I thought was interesting. It wasn't something that I had thought would be on the website. So the gambling problems can result in significant debt, family disruptions, job losses, criminal activity, or suicide. And some warning signs of gambling addiction are denying there is a problem, lying about where the money is going, borrowing money to gamble or pay off debts, taking time off work to gamble, losing touch with friends, and looking for that high that comes with gambling. The website also has tobacco prevention services. It has a list of agencies that someone can contact for free help to quit smoking. And they also have a 1-800 number, Quit Now, for help quitting as well, which is a 24/7 phone number. The Dauphin County Department of Drug and Alcohol Services also offers free training. It's implemented an in-house free of charge training for those interested in treatment and prevention related training. The training is called the Institute for Community Excellence and Education, and on their website they have 3 months. It's like a 3-month block of when and where these trainings are being held. So if you're interested, you can sign up. How clients are referred for services. All Dauphin County residents are eligible for services. Individuals can contact Dauphin County Drug and Alcohol directly or one of their providers for an evaluation. And again, the providers are listed on the website. When I was speaking with Kristen, I was interested in how older adults who are struggling with substance use disorder, what they would do to help the older adult. And she said they would most likely work in conjunction with the Dauphin County Agency on Aging to help with our get them services. And she said probably a peer program would be the best option for an older adult, because it's someone who is a peer, who's closer to their age, who's gone through the addiction and rehabilitation process. She thought it would just be a little bit more beneficial than having an older adult maybe go to rehab or something like that. The regulations for Dauphin County is they have to follow the regulations set by the Pennsylvania Drug and Alcohol Programs. And their mission statement is to engage, coordinate, and lead the Commonwealth of Pennsylvania's effort to prevent and reduce drug, alcohol, and gambling addiction and abuse, and to promote recovery, thereby reducing the human and economic impact of the disease. Funding Dauphin County Drug and Alcohol Services is funded by the state of Pennsylvania, and insurance is accepted. However, Kristen had mentioned that the main population they serve is the uninsured and the underinsured. So the Dauphin County Drug and Alcohol Services does pay for services for those who don't have insurance or who are underinsured. Ethical standards. They have state mandated training. She had mentioned that they have to do this training every 2 years. Their confidentiality, she mentioned, is very strict. It's stricter than HIPAA laws. Kristen had mentioned that if I came in for services and my husband called to get information regarding me reaching out to them for services, she said they wouldn't be able to provide them with any information. And she said dual relationships are not allowed. So an example that she provided was if she were at a grocery store and she saw a client, she wouldn't go up and say hello or anything like that. And if they came over and said hello to her, she would keep it strictly, formal, I guess, because you're not allowed to have a dual relationship with the clients. Documentation, Kristen had mentioned that they just switched everything over to electronic records. So if the document is written, that it gets shredded, and everything needs to be documented immediately or by up to 7 days. So the ways the organization values, encourages, and embraces diversity is one way she said is through inclusive staff hiring. She had mentioned they just hired a transgender woman, which she said has been a great addition. She's been a great addition to their staff. Not only is she great at her job, but she also is helping to teach her staff and employees of discrimination that she's faced with previous employers. And Kristen said it just helps because they work with all cultures, so having cultural competency is important for their organization. Greatest challenge as a human service worker. Kristen had mentioned that she thinks the funding would be the greatest challenge because there's never enough funding. The staff, for the amount of work that they do, they're not paid enough. She said that funding gets in the way of raises because you also have to have enough money for the clients who need the services. And she did mention that the Dauphin County Department of Drug and Alcohol Services is one of the lowest funded agencies. They have one of the smallest budgets, which I was really surprised about. surprised to hear. So my overall thoughts regarding the agency is they have a lot of information on their website. They have a lot of providers. I didn't realize that they pay for services if the individual doesn't have insurance or can't afford to pay for services. The student program I thought was very interesting and really helpful for anyone who is interested in being trained. I mean, that could be helpful for everyone. And the training, the free training programs that they offer, I was unaware that was even an option. And again, I think that's a great program that they provide to the general population. So thank you for listening to my presentation, and I look forward to your feedback. Thank you.